Welcome back. Endometriosis is a painful condition in which tissue that normally lines the inside of the uterus growing outside it. It affects women of childbearing age and is what we're looking at on Health Talk this morning.
Endometriosis affects women in their prime, though experts say this is not caused by lifestyle, but it affects women in their day-to-day activities. What is endometriosis? What are the causes? What are the symptoms? And how can a woman know that for sure she has endometriosis? That is our talking point on Health Talk this morning. Hello and welcome. Joining me on this topic this morning is Dr. Aboh Ajayi. You are welcome to the program, sir.
Thank you very much, Toyin.
So, what is endometriosis?
Well, endometriosis is usually a painful condition which usually affects the quality of life of the women who have it and can also lead to infertility. But it's a condition that arises out of the fact that the normal lining of the uterus, which we call the endometrium, being present in other places apart from where it's supposed to be. So what happens in essence is that every month, just like the woman the endometrium goes through the cycle of building up and then shedding what we call menses, this endometrium also in all those areas also undergoes the same cycle. So the woman is like bleeding inside the abdomen because this blood cannot find a way to go out.
What age range does this condition affect?
Endometriosis can start from a woman's first menstrual period. Because, I've been telling you that the symptoms are usually related to the menses, because if you are not bleeding from menstrual period, you are not likely to have the endometriosis, like you are bleeding from the wrong places, okay? So, it can start right from your first menstrual period, and that's what in advanced countries now, what they're trying to do is to diagnose endometriosis as early as possible. So they're looking at the teenagers and all that stuff. But we know it's commoner in your reproductive age group, so from about 20 to about 35, that's the peak period of when endometriosis can be diagnosed. Because again, sometimes some women have lived with that pain all their life. Why they're going to the doctor is that suddenly they're finding it difficult to achieve a conception. So infertility is one of the reasons why people go to the doctor, and then we see that the patient has endometriosis.
I've been listening to all this now. How can a woman know for sure that she has endometriosis?
Well, unfortunately, there is no way you can be cocksure, but you can have a suspicion. If you have some of the symptoms that we've been talking about, then you should be able to go to your doctor. And sometimes you might have to be straightforward about it and say, doctor, do you think I have endometriosis? Because until about 25, 30 years ago, we thought endometriosis was not a disease of blacks. So if that doctor still belongs to that age group or is still thinking in that realm, you might be the one to make him remember, okay, endometriosis, okay. And then he might be able to help you to make the diagnosis. But it's not likely that you can make the diagnosis on your own, because actually for you to be able to be sure whether a woman has or does not have endometriosis, you need to do a procedure we call laparoscopy, or to look inside the abdomen without cutting her open, which we call pinhole surgery sometimes. So that is the best way to make a diagnosis of endometriosis. The other things like scanning, like doing a physical examination, like the history, they're just pointers to the fact that the woman might have endometriosis.
At what point will a medical doctor know that endometriosis in a woman has degenerated to infertility?
The relationship between infertility and endometriosis is really a little bit vague. You have to treat it. The woman is trying to get pregnant, she's not getting pregnant. So during the course of doing your test, that's when you might just discover that she has. But if you listen to her history very well, just like we said earlier on, might make you suspect. If you do your physical examination, might make you to suspect. If you do a scan, might make you to suspect. But such a patient, you probably need to order for a laparoscopy to be done on her. Now, if the infertility is as a result of endometriosis, it's a little bit more difficult to treat. because endometriosis now makes the infertility a little bit more complicated, because it means you have blood and some other substances somewhere where it should not be, and that can kill sperm, it can kill eggs. So that's why it's important when you make such a diagnosis to send to the people who have the knowledge of endometriosis.
Knowing all these facts about endometriosis now, what are the various treatment options available to treat this condition?
Treatment will depend on what the patient is complaining about. Is it pain? Okay, then, but that's after you made the diagnosis. Is it pain? Then you probably have to relieve the pain. And there's some analgesics that you can use. Both hormonal and non-hormonal drugs can be used for that. I usually don't like mentioning names of drugs so that patients don't abuse drugs. So there are analgesics that can be used for that. Then also surgery can be done for pain. But what we try to do, except the facilities constrict that, is that we usually prefer that you do laparoscopic surgery for endometriosis, because there are a lot of scar tissue involved with endometriosis on its own. We want very minimal tissue handling so that you don't form scars more. So laparoscopy, but sometimes if there's no laparoscope, then you can do open surgery. So surgery can, because what we do mainly is to take out the blood and then where they're not supposed to be and all the debris, and just what we call debulking surgery. So it's possible to do that. And then we can also give drugs after the surgery, before or after the surgery, and then to further melt the other implants that you cannot remove. But when all this don't work, especially when you have infertility and we've tried surgery and it doesn't seem to be working, then the only thing you'll be able to do will be assisted conception or IVF.
So one of the most important questions our viewers will want to know, will you say endometriosis is curable?
Unfortunately, endometriosis is not curable, but it can be managed. And that's why what we are asking for is that the diagnosis be made early, so that before even infertility creeps in, you know that you have endometriosis, and it can guide all your decision making. For example, somebody with endometriosis is not the person that should postpone raising a family to the last stage. Okay, so you need to make some conscious decisions. Do you need to store your eggs? You might need to make such a decision. So it's important for the diagnosis to be made early, so that some of these decisions can be made early.
What should a woman do after she discovers that she has endometriosis?
When you know you have endometriosis, the thing to do is that you must read a lot. Like any other condition, you must know about the condition. And so that it guides you even in knowing the doctor you can see and the ones you cannot see. So that some people don't end up making your condition worse. So you need to read a lot and then ask questions. And endometriosis is not something you need to be ashamed of. It's not as a result of anything you have done. It's the way you were born. And therefore, people should be free to talk about it. So I think, and then choose the hospital that you're going to go to carefully.
Is endometriosis hereditary?
We think so. We think it's because we know that it runs in families. Your chance of having endometriosis is increased when either your mother or first-degree relative has endometriosis.
So, gradually coming to the end of the program now, what are the preventive measures against endometriosis?
Well, since you are born that way, it cannot be prevented. So, what we can do is to make early diagnosis.
Well, it has been so nice having you on the program this morning. I'm sure our viewers at home must have picked one or two informations on endometriosis. Thank you for being part of the program. Well, I've been speaking with Dr. Abayomi Ajayi, and has been educating us on endometriosis, what steps women need to take when they discover they have this condition. That's the program this morning. Join me again next time. My name is Oluwatoyin Aboh. Bye for now.
We'll take a short break and return with the news on the dot of 8 o'clock. And of course, we'll be doing Talk Time this morning. Stay with us.